I first started my symptoms at approximately the age of 23 or 24. Due to probably being overworked, stress, and not eating appropriately, I couldn't lift, bend over, pick up heavy type of equipment or materials. I couldn't exercise. I had to stay away from a lot of different foods, spicy foods, fatty, greasy foods, definitely high in fat content, and alcoholic beverages. I couldn't sleep at night, and I wasn't able to work, so that was affecting my quality of life, so therefore I knew that I had to get something done with it. The doctors diagnosed me with GERD and acid reflux, so they gave me medications. Quite a few of them didn't work. One actually started working, and I was on that for approximately like 13 years. They kept increasing the amounts, which I'm not one that likes to take medications, so I was looking for an alternative way of getting rid of this acid reflux and GERD.
So Ryan is a young patient who has been suffering from severe acid reflux, who does not want to be on PPIs for the rest of his life. At the same time, we don't want to do a permanent change in his anatomy by doing a wrap to fix his acid reflux. So he meets all the criteria. This is my ideal patient. A young patient does not want to be on medications for the rest of their lives and don't want to change a permanent change in their anatomy.
So I started researching on the internet, and I located the product called Lynx. I talked to my GI doctor, and I mentioned the name Dr. Sadik. Just went forward to setting up an appointment with him, sat down, did a consultation. He looked over the reports that I got from the other GI doctor, and he recommended me, saying that I was a good candidate for the Lynx product.
Most patients suffer from acid reflux and think that it's just something that they're born with and they have to live with for the rest of their lives. Acid reflux is something that 250,000 Americans suffer from every year. And medical treatment is just a way to mask the symptoms and prevent the acid from being formed. Surgical repair is the only way to correct the problem.
I had the procedure. It wasn't very painful. I mean, it was actually very easy.
I allow the patient to be on their medications for about 2 to 4 weeks, and then I take the medications off and then control the symptoms and see what the symptoms do that way. And most patients are symptom-free from there on. They don't use any PPIs or any other meds, and their acid reflux is controlled.
Lynx has changed my life in many ways. I'm able to produce a lot better at work, better quality of sleep. I'm not suffering through that, and then having the next day affecting it as well, and I can eat whatever I want. I have no problems going out and having dinners, and I have had no symptoms, and I had the procedure approximately about 4 years ago. Being able to do what I want, not worrying about what's constantly what I can't do, what I can't eat. When it's always on your mind, it affects you in many ways. I feel like I'm really actually living a life now.